So what is the background to New Zealand indicators, outcomes and benchmarking? Well, I mean, for the last decade, really, New Zealand has been trying to develop an outcomes culture. And we've made some really good strides forward in doing that. We still have some way to go, of course. I think there's been three main factors which have helped us to develop an outcomes culture. There's been many more, but it's three main things. One has been the development of a suite of outcome measures, which we've been implementing into our mental health and addiction services. The second thing is that we've developed a key performance indicator benchmarking for our services. And the third thing, which has been extremely important and hard to overstate really, has been the development of a national mental health and addiction collection system that we can report against. What's currently happening with regards outcomes indicators and benchmarking in New Zealand? Well, we're continuing to implement the HONOS family of measures as our selected outcome measures for our mental health services here in New Zealand, and that's going well. We've developed an outcome measure here in New Zealand for our addiction services, which we call ADOM, somewhat prosaically, the addiction outcome measure. And we've developed a measure which is particular to our Maori services called the Hua Oranga, which again is very exciting that we've developed our own Indigenous outcome measure here for New Zealand. And we are continuing to work on our key performance indicators for our inpatient services. And we're now starting to work on developing benchmarking for our children and adolescent services and for our forensic services. So in terms of the future, what are the developments around indicators, outcomes and benchmarking for New Zealand? We're going to continue to embed outcome measurement as a routine part of clinical practice. We've found that this has certainly delivered some good results for us as a country, and we're going to continue down that path. There's going to be new outcome measures that we want to add to the mix. Exactly what they will be is yet to be determined. We're certainly going to want to add more outcome measures. We're going to embed the key performance indicator project in a business as usual model for our services across New Zealand. And we want to more actively start to benchmark services against each other. Again, this is starting to deliver some real results for us, and we want to sort of take it to the next step really now. So how is New Zealand participating in the international benchmarking project? New Zealand has been a very strong supporter of the international benchmarking project right from the start, both financially, in terms of providing financial assistance towards the project, and in terms of our active involvement in the research itself. I'm pretty sure that's going to continue going forward. Many of the KPIs that have been developed as part of this international KPI project are very similar to KPIs that we've developed here in New Zealand, and so that's going to make it much easier for us to actually be part of this project, I would imagine. New Zealand's very keen on being part of this international benchmarking project because it's going to enable us to actually have some international benchmarking and actually start to compare jurisdictions against each other. We're doing that already internally in New Zealand in terms of our services, but it's going to be very exciting to actually compare jurisdictions with each other, which is obviously something we're going to be able to do once we've got this KPI information up and running. Professor Pincus mentions in his video around the development of recovery indicators and a recovery measure. This is also something that we wanted to do for some time here in New Zealand, and again it's very exciting. And clearly if we can develop an international recovery measure and some international recovery indicators which are valid and reliable, we'd be very keen to use them here in New Zealand as well. And again, that will provide another additional way of benchmarking our services here in New Zealand against some international comparisons. So all very exciting, I think it's fair to say. Overall, the use of indicators, outcomes, and benchmarking has the ultimate objective of improving the lives of the people that we actually serve in our mental health and addiction services.